As you may well recall, my last broadcast on this pandemic was on March 19, 2020, when we took our first decisive steps against this menace by announcing the suspension of schools, nightclubs, bars, weddings, funerals, Ofala festivals, and other social events that bring people together in one place. Update on testing and results. Here is an update on what has happened since my last broadcast. In Anambra State, with respect to our experts, my Commissioner for Health, Dr. Vincent Omala, has reliably informed me that at this moment in time, our dear state does not have a single record case of coronavirus. 10 samples on the whole have so far been sent to Irua, and we have received the result on 6 of the samples, and they're all negative. We're also hopeful that the remaining 4 will also turn negative. Please note that the samples are usually taken from what the experts call case description. Case description is a situation where an individual who has just returned from any of the countries and cities that have serious COVID-19 cases begins to show symptoms of coronavirus. Or a situation where someone who has come in contact with people suffering from coronavirus begins to show symptoms of the pandemic. These symptoms are usually cough, runny nose, fever, and a difficulty in breathing. Samples are usually taken from such people and sent to the testing center. So far, Anambra State is safe, but we shall continue our efforts in testing to ensure that coronavirus does not take us by surprise. Update on the isolation centers. We have successfully set up a 250-bedroom isolation center in the NYC Orientation Complex at Umawolo, and another 16-bed isolation center at the General Hospital on Onitsha. By the grace of God, I shall commission both centers tomorrow. The Onitsha Isolation Center has been described as one of the best in the country today. At the same time, the isolation center at Chukwuemeka Odumegwu University Teaching Hospital, Amaku, Oka, is being fitted out to standard just in case we have an outbreak. Meanwhile, we have 2 such centers at Ekulabia General Hospital and Umberi General Hospital. In Anambra, I'm happy to announce the management of Fidelity Bank and management of Access Bank of Nigeria have both volunteered to equip the such centers at Ekulabia General Hospital and Umberi General Hospital respectively with a 60-bed facility each that meets the World Health Organization standards. I have been assured that both facilities shall be up and running within a few days from now. On behalf of Anambra, I express my profound gratitude to Fidelity Bank and Access Bank for their kind gesture. Economic stimulus package. In Anambra, our response to the threat posed by the coronavirus is multi-dimensional. We have mounted a massive awareness campaign and all media platforms to enlighten our people on the threat of coronavirus. We have closed our boundaries with neighboring states and shut down our 63 major markets in Anambra State to flatten the curve in this virus attack. We have set up isolation centers and equipped them with facilities that meet World Health Organization standards. And finally, we have also rolled out an economic stimulus package to cushion the effect of steps we have taken against the virus on the most vulnerable members of our society. We have commenced the distribution of 200 bags of rice to each of the 181 communities in Anambra State to be distributed among senior citizens 70 years and above. In communities where we have more than 200 people within this specified age bracket, distribution shall start from the oldest to the youngest in the age bracket. Beyond that, we have also given a 10% relief on personal income taxes to businesses in Anambra State for the year 2019. This means that if you have been paying your taxes regularly, you get a 10% refund of the entire sum you paid in 2019. I have no doubt that this will be of great help to our businesses in the state. Interventions from the private sector. Our call for assistance for corporate bodies and successful in Anambra have started yielding results. So far, we have received the following donations in cash and equipment from the following people. UBA PLC, 28,500,000 naira. Ibeto Petrochemicals, 10 million naira. J.I. Edison International Limited, 5 million naira. Chief Ken Wobo, 5 million naira. Chief Edison Ukeje, 5 million naira. Chief Daniel Dozie of Dozie Oil, 2 million naira. Senator Victor May, 2 million naira. His Royal Highness Igwe Gerard Mbamalu Igwe Joto, 1 million naira. Chief Godwin Ezimo Chukunenye, 500,000 naira. Obinno Kechukumosu, 3,000 naira. 7Com Enterprises, 2,000 naira. Dr. Ernest Azumdialo Obiedesi, Obi Jackson, 4,000 facial masks and 900 personal protection gear for the medical doctors, the disposable gear. Other illustrious individuals of the state that have pledged to assist the government with personal protection equipment and other medical supplies are Chief Engineer Ato Eze, Dr. Cosmas Madoka, Chief Innocent Madoka Innocent, Sir Emeka Ofo, Chief Chidi Anyebu, Chisco, Ima Bishop Okonkwo, Ekulo Groups, and Chief Allen Oyema. In the Anambra, we are still appealing for donations to boost our capacity to overcome the threat posed by this pandemic. We especially need ventilators and personal protection equipment like gloves, goggles for the eyes, and apparels and masks for the doctors. We shall appreciate any intervention that will strengthen our capacity in these areas. What we shall do next? The Anambra, we are determined to strengthen our campaign against coronavirus in our dear state with the following measures. 1. We shall soon commence the distribution of 3 million masks to residents of Anambra State in the 181 communities in Anambra. The Igwes and the PGs will assist the government in profiling the tailors in the various communities that will help in mass producing these masks for distribution to the members of their communities. Our intention in handing out 3 million masks is to ensure that after the 14-day shutdown of the state, no one will step out of their home without wearing a facial mask. The Czech Republic is relying largely on the heavy use of facial masks to minimize the incidence of coronavirus in their territory. These masks shall be made by our own tailors, carefully selected, and from each of the 181 communities of our state. The modalities for the manufacturing and distribution of the masks shall be worked out and announced subsequently. 2. We shall also commence the fumigation of the 63 major markets in Anambra State while traders are at home. This will help to reduce the toxicity of the business environment and minimize the exposure of our people to different kinds of infections. 3. We are giving a 2-month waiver to keke and shuttle bus operators in the state on their usual permits they pay. The grace period covers the month of April and May only, 2020. The leadership of the Tricycle Union and Bus and Shuttle Drivers Union have also given a 2-month waiver to their members. to cushion this effect. I hope that this will cushion the sudden fall in their income occasioned by the restricted number of passengers they are expected to carry and at a time these days. This is also a part of our economic stimulus package for the vulnerable. To ensure that our children are not adversely affected by the closure of schools, we have migrated our classrooms to radio, television, and Facebook. In partnership between the Anambra Broadcasting Service, ABS, and the Ministry of Basic Education is meeting the education needs of our children with a program titled Anambra Teaching on Air. Visit the ABS website for further details. We are ready. Finally, in the Anambra, learning from the experiences of the approaches adopted by France and Lagos in battling this pandemic, we have stockpiled the medicines used in managing outbreaks in both places in case we experience an incident here. I therefore urge you to be calm and ensure adequate compliance with the standard directive of COVID-19, which includes wash your hands regularly with soap, use hand sanitizers regularly, cough and sneeze in a protected form, and put on face masks while out of your house. In other words, we want everybody walking on the streets in Anambra to wear a face mask. That's what we say. And more importantly, stay home and stay safe. Before I end this broadcast, I must not fail to thank the entire business community in Anambra State for complying with our directive on COVID-19. I want to particularly thank the churches, the Catholic Church, the Anglican Church, the Pentecostal churches for their unalloyed support during this trying period. My gratitude also goes to the civil society, civil servants, the traditional rulers who have lent their voices to the enlightened campaign of coronavirus. I'm also very thankful to the people in the essential services, medical doctors, the nurses, and the other people assisting the medical doctors, and all the staff of the Ministry of Health for their tireless effort to ensure that this challenge does not come to us. I want to thank very particularly the members of Operation Bochapu 2 who have been coaxed into this COVID-19 operations. They've done well in ensuring that our borders remain closed, and they've done well in patrolling to make sure that no crime or incidents are recorded during this stay-at-home period. In conclusion, the Anambra, I urge you to see the threat of coronavirus as a great threat to us all and as one people under God. I urge you, therefore, to come together as one and shut out this pandemic from Anambra State. In Anambra, we can do it if we truly come together. In the words of the American auto icon, Henry Ford, I quote, "Coming together is a beginning. Staying together is progress, but working together is success," unquote. I have no doubt that if we all wash our hands regularly with soap, use hand sanitizers regularly, cough and sneeze in a protected format, put a facial mask while going out, and most importantly, stay at home and stay safe, we shall win this battle and eventually win this war. God bless Anambra State. God bless the Federal Republic of Nigeria. God bless you all. Thank you.